Hey everyone, let's jump straight into it. Today we are tackling a topic that feels, honestly, uniquely urgent. It's deeply personal, yet highly systemic all at once. We're talking about the complex crisis of burnout. Throughout this explainer, we're going to draw from an incredibly insightful presentation given by Dr. Sermsak Lolak at the APA annual meeting. We're going to look past the typical workplace buzzwords, examine the hard clinical data, and actually figure out how we can protect ourselves. Okay, let's dive into this. Feeling burned out? Look, if that phrase resonates with a deep, heavy exhaustion right in your chest, you are absolutely not alone. It is so easy to just dismiss this as, part of the daily grind. But today, we're using this time as a structured space to validate those intense feelings with actual real-world clinical data.
Section 1, the anatomy of burnout, defining the diagnosis.
To truly grasp the scope of this problem, we really have to move past burnout as just a trendy corporate buzzword. Clinically speaking, it's a syndrome built on 3 core pillars. And here is the very first domino to fall: emotional exhaustion. It manifests as feeling completely, utterly emotionally overextended. You aren't just physically tired, you're losing your baseline enthusiasm. You show up, sure, but there is absolutely nothing left in the emotional tank for your job. Now, what's really interesting about this slide is how it highlights the second and honestly, perhaps most dangerous pillar: depersonalization. This is where burnout becomes profoundly alarming, especially if you're in a service-oriented field. Depersonalization literally strips away your empathy. It replaces your normal human connection with this deep, heavy cynicism, where patients or clients suddenly become objects or just tasks to be managed, rather than actual human beings. It's a terrifying symptom for caregivers. That leads us to the final clinical pillar: a reduced sense of personal accomplishment. This is that heavy, sinking feeling that your work just isn't meaningful anymore. Think about it. So many professionals enter these highly demanding fields driven by a profound sense of purpose. But when burnout sets in, that purpose completely evaporates, leaving behind a massive void.
Section 2, a growing clinical epidemic. The prognosis.
This isn't just an isolated issue for a few unlucky people. We are looking at a systemic epidemic. And the hard data? It is staggering. And this brilliantly illustrates exactly what we're up against. Look at the undeniable jump in this chart. Comparing surveys of over 3,000 physicians, we see that in just 3 short years, from 2011 to 2014, the rate of professionals reporting at least one symptom of burnout jumped from 45.5% to over 54%. That is a massive, incredibly rapid escalation.
So, how does this actually break down? Well, the highest risk areas are exactly the intense ones you'd expect: emergency, internal, and family medicine, along with neurology and radiology. But here is the real kicker. Even in specialties that are generally considered lower stress, or at least better for work-life balance, the numbers are still totally grim. Psychiatry sits at 40% and dermatology at 30%. To put that into perspective, across the board, these physicians are at a massively higher risk than the standard U.S. working population.
Section 3, the severe cost of caring, the symptoms.
So what actually happens when we let this unchecked epidemic run its course? Well, the symptoms cascade, and they cascade rapidly. It might start quietly, right? A little poor self-care, some bad sleep, but it quickly bleeds into the workplace. You start seeing interpersonal conflicts rising, corners being cut, maybe a heavy reliance on sarcasm. Eventually, the psychological burden becomes so intense that highly trained professionals literally wish they were sick just to avoid going to work. And tragically, this evolves into severe psychiatric and physical outcomes. We're talking addictive behaviors, PTSD, and even suicidal ideation. This data is harsh, but it proves how common and frankly how lethal these outcomes really are.
Section 4, cultivating compassion and mindfulness, the treatment.
Okay, having looked squarely at those really harsh clinical realities, I want us all to just take a collective breath. Seriously, let's just pause. We are pivoting now from the heavy problem to some actionable hope. The core of Dr. Lolak's treatment approach is finding grounding through contemplative practices. Instead of being completely swept away by that overwhelming tide of clinical demands, it's about deliberately practicing mindfulness to return to the present moment. Let's move to and see how this builds into real, everyday life. How do we turn mindfulness into concrete action? Dr. Lolak maps out 4 very practical steps to rebuild your resilience. Step 1, identify what is actually meaningful to you in your job and fiercely protect it. Do it at least 1 day a week. Step 2, actively build a supportive community at work through mentoring and positive interactions. Step 3,
push to change the work environment itself to ensure fairness. And step 4, actively learn and strictly practice stress reduction techniques.
When we're faced with intense stress, we essentially stand at a crossroads. Down one path are the destructive reactions, slipping into pity, lashing out in anger, avoiding things entirely, or operating in complete, numb mindlessness. That is the fast track to emotional exhaustion. But down the other path is proactive healing. This means intentionally choosing compassion and mindfulness. And listen, these aren't just soft, abstract, feel-good concepts. According to the clinical data, they are absolutely essential survival tools.
Understanding burnout is really only the first step. Putting the treatment into practice is where the real change happens. So I want to leave you with this thought. How will you bring mindfulness and compassion into your very next shift? How are you going to reclaim your meaning? It's a big question, but an important one. Thank you so much for joining me today to decode this critical topic. Take care of yourselves out there, and seriously, try putting some of these actionable steps into practice today. See you next time.